every system rests on its ability to be self sustaining. So we understand that the people in the boardrooms want to see the profit.
What would you say is the best way to approach providers?
It's too costly for their patients. They don't want your pre authorization processes to prevent their patient from getting the right care, right time, right place.
What's your opinion about the current AI-driven tools for medical review?
Of all of this, AI is still the newest on the market, so it's too soon for us to say we're there, but it's nice to see.
How do you see the healthcare industry evolving?
Again, we cannot do these things in silos.
Welcome to Healthcare Journeys, a podcast by S2M Health that explores the personal and professional stories shaping the future of healthcare. I'm Claudia Gallardo, and I'm thrilled to guide you through conversations with healthcare leaders who are driving change and innovation across the industry. On today's episode, we're honored to have Dr. Ekaette Joseph-Isang with us. Dr. Joseph-Isang is a transformational healthcare leader with a proven track record of building scalable systems from the ground up at organizations such as Anthem, Guidehouse, Honest Medical Group, and Rightbridge Consultants, where she serves as a CEO. I'm excited to dive into her journey, including her transition from patient care to the business side of healthcare, and hear her insights on navigating the evolving landscape of the industry. Dr. E, welcome to the podcast.
Thank you so much. I'm excited to be here, Claudia. Thank you for having me.
Thank you for joining us today. I'm so excited about this conversation. I know a bit about your journey, but I'm excited for our audience to learn more about your background and your transition from patient care to the business side of healthcare. Right? It's a very different experience, I'm sure.
It is. It quite is.
So, just to start, I think we would like to know what drew you to the field of healthcare, and did you always envision yourself in healthcare?
In a sense, yes. I have always envisioned myself in healthcare as a firstborn daughter. The maternal instincts just came naturally to me. So, from wanting to take care of people to wanting to improve things around me. Additionally, I was born and raised in Nigeria. And when you're born and raised in Nigeria, the standards are super high that are set for you. And so when you're a smart kid, your parents will tell you doctor, lawyer, or family disgrace. I don't know if you've ever heard that about Nigerians. So I was the first daughter. The natural route was for me to pursue medicine as a career. And I also liked it. I had the natural inclination to want to make things better. So it all came together.
It all came together. Wow. And you decided to go into medicine, and where did you study? Like, where did you go to school?
So I went to medical school in the University of Calabar in Cross River State, Nigeria. Cross River State is in the southeastern part of Nigeria, pretty close to the Atlantic Ocean. It's famous for culture, heritage, beautiful scenery, and seafood. So I went to school in the University of Calabar Medical School, and it really shaped my medical journey because it's a very highly rated medical school, and I really had great professors who taught me medicine in a way that I could live medicine, sleep medicine, eat medicine. You can wake me up any time of the night, even when I'm not actively practicing, and I'll just spew out my medicine because it was really ingrained into me.
Wow, amazing. Well, you shared with us you were a firstborn. It was kind of natural. You had to choose medicine, but was there a confirmation early in your career that healthcare was the right path for you?
Yes, because we would have career counselors come to school, right, to talk to us about so many different things. They would talk to us about engineering, they would talk to us about accounting, they would talk to us about law. But whenever doctors came, whenever clinicians came, I just naturally gravitated towards it because of the curiosity around the human body, right? I said to myself, look, how I was just fascinated with the human body, fascinated with wellness, fascinated with health. And I said to myself, this is one career that really doesn't change regardless of where you go. Anywhere you go in the world, the human body is the same. Language may change, methodologies of doing things may change, but anywhere I am as a doctor, I can save lives, I can serve lives, I can make people live better. And so that natural curiosity, I don't know if it was because I just went towards medicine and I did great as a practicing physician. I enjoyed my time in the bedside, in the consulting room, and everything just seemed like this is what it was meant to be. And so as I passed through school and I was acing my classes, even my teachers confirmed and said, you should be a doctor. You would make a great doctor. So everyone around me, plus my natural inclination, gave me that confirmation that that was where I really needed to be.
So you knew that that was the path, and at some point you decided to transition from patient care to business. So talk to us about that journey. And it might be a long journey, but we're here for it. You know, we want to hear the details on and what made you decide to transition
So, what made me decide to transition to the
to the
business side?
business side.
Absolutely. So, when doctors work in the field, most of the decision makers are administrators, people who do not have medical backgrounds, telling doctors, this is how you should practice. This is what we want you to do. You don't need to spend 30 minutes seeing one patient. You need to spend 15 minutes seeing a patient. But then the doctor wants to build the rapport, the relationship with the patient. The patients sometimes see their doctors as the be all, the end all. The doctor is a therapist, the doctor is a counselor, the doctor is a support system. And so when some of these decisions are made around speed and efficiency, doctors don't enjoy it. So, who's speaking on behalf of the doctors? Having practiced in Nigeria for a while before moving into the US, I had a professor, Professor Ekaette, John Ekaette, who would say to us, look, we have all of the struggles getting our voices heard because there's no one from our end that is in those policy making meetings, making the decisions with doctors. So people who do not understand the passion behind medicine, the why for the doctors are making those decisions. Understandably, every system rests on its ability to be self sustaining. So we understand that the people in the boardrooms want to see the profit. Great. But we don't want the profit at the detriment of patient outcomes, right? We don't want the profit and the patient is just a number. We want the patient to be a person. So when I started studying the business side of healthcare, the technology that affected healthcare, I realized you need somebody at the intersection. You need a boundary spanner. You need someone who understands clinical medicine, the business of medicine, the tech behind medicine, the policy that drives the decision makers to be in the rooms where these decisions are made so that providers, the payer, which is likely the government, the patients, all have someone who understands the language and advocates for them. So that was how, in stepping around, studying all of these different aspects, I said to myself, you just might be that right bridge that gets to that center and bridges the divides and breaks the silos. And that's even the reason behind my business name, just being that bridge that serves us, the person who interprets the language for everybody on both sides. So here I am today.
What was the most challenging aspect of that transition? Because seeing the other side, seeing the challenges from both sides,
Mhm.
you probably encountered lots of challenges in that transition. Can you talk to us about some of those challenges?
Yeah, so the challenges, first of all, are the novelty around it, right? You're a doctor. Why don't you just focus on practicing medicine? What are you doing here? Why do you want to come here? Like, we don't even have enough doctors, so don't leave the bedside, right? So it's feeling welcome in those places. People are not used to having you in those rooms, so they wonder why you are there. And then interpreting or communicating with those people and saying, this is my why, right? Listen to the doctor perspective. So that communication, having the language to tell them why you need to be there, why they need to listen to you, and why this matters to the doctors. So just being welcome and communicating with the people, and then bringing together all of those silos, because it's not just the doctors that are involved, it's not just the policymakers are involved. You have the nurses, you have the pharmacists, you have the tech, you have the patients themselves, you know. So the greatest challenge is getting all of the different disparate stakeholders to speak the same language and come to an agreement about what needs to be done.
I think you bring something really important, which is um, breaching the two areas, right? Business and patient care from the provider perspective and the member perspective, ensuring that they get the care they need, but nothing is compromised, from any side. And that is a very challenging to do. I think that I think it is really, but it's really necessary. Your role is extremely important to bridge the two areas. Um, yeah, go ahead.
Yeah, absolutely. Especially, you know, as a doctor, right? It's not that you don't always look for consensus, but when the patient is sitting in front of you, you have to make a decision. You're not going to leave the room to go ask another doctor, what should I do? Right? You want to solve the problem. You're in the emergency room, the patients come, it's fast paced. They come in, you make sure the airway is there, you make sure they're breathing, you make sure the circulation is there, you set up the line, you know, you're going boom, 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 and then you step onto the other side and things don't move that boom boom boom. So you have to take a deep breath and know that you're no longer in the emergency room where you're just calling the shots. So you have to listen to everyone. Where are they coming from? They have a point, right? So you learn consensus, you learn conversation, you learn to really explain yourself, because in the world where you're coming from, everyone is speaking the same language. They already know what you're saying, they get it. But then you have to start communicating with a different set of people who probably have the same motivations as you, which is patient outcomes, wellness, but who approach it in a different way. So, with that, you just have to learn how to talk to everyone in the language in which they understand.
Their own language, yeah. And you being a physician, I think you can speak both languages, right? You can speak the provider language and the business language. I have a question for you, and I want to go back to your career transition and your growth. But now that we are touching on provider, um, and I know a lot of, many companies face challenges communicating with providers. Providers are traditionally not, I wouldn't say a difficult group to reach, but they are busy taking care of their patients. So, getting a hold of a provider is hard. Um, what would you say is the best way to approach providers? It just, if you had like a suggestion, like an insight, is there like a magic key?
Well, everything is contextual, right? It depends on the context in
Mm,
which you are approaching the provider. And you always want to speak to people in a language that they understand, right? What is in it for them? Is this just another policy? Is this just another bottleneck? Is this just an extra thing in their workflow to please you on the business side? Or does this help the patient? Providers just want to help their patients. They want their patients to be well. They don't want their patients to have difficulty accessing care. They don't want it to be too costly for their patients. They don't want your pre authorization processes to prevent their patient from getting the right care, right time, right place. So, if you keep the patient at the center of your changes, if you keep the patient at the center of your decision making, the providers will listen to you. And then you don't want to bore providers with business speak. When you approach the providers, get straight to the point. That's
mm.
it. And so let them know what it is you're doing for their patients and how they can help you make it happen. The providers will respond.
Yeah, that's great. Thank you for the insight. Yeah, I think providers are receiving many communications from a lot of different organizations, right? From health plans, their own practice administrators. It's a lot. So I think it's important to create a smart strategy on how to approach providers and to have the right tools in place to approach providers the best way, right? Like you say, speaking their language and just be concise on what you need and just, not try to get too much too fast from them because they are busy. Um, Going back to your career transition, you're someone who's held various roles in quality and management, through your career. What have been the key factors driving your career growth?
So, I'm a lifelong learner, as cliched as it may sound. I enjoy learning and I enjoy process improvement. I always look for what could be done better, faster, easier, with more results. So, I started out in clinical medicine, like I said, and I saw the entire gamut of clinical medicine, right? Of course, in medical school, you rotate through different departments. As a house officer, I rotated through different departments. I've worked in rural areas where I have had to be the doctor, the nurse, the phlebotomist, the lab technician. I've also worked in sophisticated systems where I have seen things work. But in all of the sophistication that our world is experiencing, our country, for one, the US, we have such a high per capita spending in healthcare. And so I ask myself, what is driving that? We have the tech, we have the people, we have the tools. So, what is it about our processes and how we do things that make us have this super high cost and we're still not getting the things we want? All the time, we're thinking of how are we innovating, what new models are we bringing up? But again, we cannot do these things in silos. We need people who have experienced the different spaces. I've worked on the provider side, I've worked on the payer side, I've worked with the government when I was a fellow in public health informatics, health systems integration, population health. I see how all of these different sides think. And whenever I'm having conversations on one side, I realize that they're missing links that they don't understand. So that has driven me to again be that boundary spanner,
Hmm.
that interdisciplinary professional, that person who communicates with all
Hmm.
sides. I tell my friends, if there's something as being multilingual in the healthcare space, I am truly multilingual
Hmm.
because I speak those languages. So my
Yeah, for
driving
sure.
force, breaking the silos, spending less, getting more, keeping all sides happy.
Excellent. Thank you for your insight. I think, learning is such a skill, right? Like a lot of professionals just we go into our workday and stop learning, and it's part of the experience, right? Like it's part of what the job, I will say, it's part of the job to learn outside of the roles that we have, right? And just expand knowledge. And now with AI,
Mm,
everything is possible. Have you explored AI yourself, like in tools in your everyday?
absolutely. Who wouldn't explore AI? I mean, the future is AI, and AI is here to stay. So the sooner we all explore AI, the better. But I tell people AI is a bad master, but a good servant. So don't let AI drive you. You use AI to serve the process. Of course, with AI, we have the ethical considerations, the privacy considerations, how much is too much. Still, I know we always need the human element. So, yes, AI in terms of vastly reviewing large amounts of medical records, bringing together algorithms. So, where I would have to think through several clinical indicators to come up with a diagnosis. AI makes the job faster. So AI is here to stay. Good servant, bad master. So let's manage AI and let AI know that we are the boss.
What's your opinion about the current AI-driven tools for medical review? There are many different tools in the market that claim to just, extract all the clinical data from a record using NLP slash AI. What's your opinion about the state of that? Like, is it advanced? Are we there yet? What's your opinion?
Are we ever gonna get there? I don't know. Are we ever gonna get there? Right? The car models change every year.
Yeah.
To tell you, the smartphones change every year. Our computer processors change every year. Of all of this, AI is still the newest on the market. So it's too soon for us to say we're there. But it's nice to see the direction in which AI is going, helping us review vast numbers of charts, and
Mm.
going as far back as human capacity probably cannot go, right? So AI can go way back in time, works faster. So great that AI is in the market, great that people are deploying it, but even greater that there is still that human oversight. We cannot outsource our thinking capacity, our creativity, our analytical mindsets, our complex problem solving mindsets to AI. AI is as effective as the programmer, as effective as who programs it. Bring it into the medical space. How many doctors are behind the AI programs? And things are changing. So I would say, short answer, we're not there, but we're doing a great job of it. And so I invite everyone to support whatever is out there and don't be aloof. Don't say, oh, that's not my forte. We all need to contribute to the success of our world and to a better world. So, AI, welcome to making a better world, but we're here as humans to control your operations.
That's so smart to say. Yeah, it is. I think that's so key to keep in mind, right? Like, we are controlling your operations, and yes. Going back to your career, I have a couple questions
Good.
around, if you could share, if there's an instance where you face a significant obstacle in leadership, and how do you navigated it? How do
Um,
you achieve success? We all have those stories, but we want to hear yours.
oh, there are tons and tons of stories. I don't even know where to start, but wherever they're humans, because our backgrounds differ, because our experiences differ, there are going to be issues, right? There are people that talk super fast, there are people that talk slow. There are people that are accented in certain ways that others were not. So there are people who view the world from a particular lens, and there are people who do not. So I came from a medical background. I want to do things super fast because in my head, we need to help the patients get well soon, move them in, move them out. But then in the business world, it isn't like that. So there are people that ask you, hey, slow down, you're being a bit too much. Slow down. Don't kill the people around you. Take it easy. And so you really want to help, you really want to serve, but well, people have their reasons, personal interests, or just the culture, the way people are used to doing things. Don't come in here, and upset the status quo. So to navigate that, you have to understand that we're all different. You're stepping into a new space, understand their motivations, and help them understand the what is in it for them. Hopefully they do. I've had to seek out mentors in my career. I have
Mm.
people that I bounce ideas off. I have people that bless their souls. I have them at the drop of a hat, and I'll just text them. I'm not going to say their names because I don't want to embarrass them, but I can text them and say, oh my goodness, I absolutely have to talk about something. And they're there for me. How can I navigate this? This is what is happening here. So just giving yourself time, stepping back, analyzing the culture around you, understanding that change is hard, right? People don't want to change. People want change, but they don't want to change. And so when the change they want requires them to change, then you realize that people don't want as much change as they claim to want, right? So
Yeah.
just understanding, doing a 360 view, and then seeking out the advice of people who have gone ahead of you.
Excellent. Yeah, it is so true. People want change, but they don't want to change themselves. So it's the hard transition. And when it comes to companies, change is exponential. I'm not gonna say we're at time because we could be talking for hours. You have a lot, a lot of interesting stories. But I want to learn more about RightBridge, and I want us to, to hear about how your consultancy started and what do you do in at RightBridge.
So RightBridge has evolved over the years. First of all, RightBridge started because of my need to support immigrant doctors who came
Mm.
to the US and could not practice medicine, but also didn't want to lose their skills. Some of them were forced to go into menial jobs, right? There's nothing wrong with those menial jobs. But when you've had all of this education, it's not great to take all of your doctor brain and go drive Uber, go be a cashier at Walmart. So I started out by teaching them about the US health system and stuff like risk adjustment, clinical documentation, integrity, medical coding, things that could build and leverage on their skill set for them to work, in alternative spaces. And then I went into healthcare strategy consulting with my consulting background. So I consult for provider groups and payer groups. And again, I'm that right brief that helps them with understanding strategy, policy, operations, compliance, and whatever it is that they're struggling with at the time.
That is a very interesting business idea, helping doctors transition to the US and not lose that knowledge, right? That knowledge which is universal. Once a doctor, you're always a doctor, no matter where you are. Um, Looking forward, Ekaette or Dr. E, how do you see the healthcare industry evolving? And what role do you think healthcare leaders like yourselves will need to play um, in the future?
So healthcare is going to be driven a lot by technology, right? Technology is going to support the things we do in healthcare. So even with diagnostics, technology is going to come in to make our diagnostic acumen even easier. That little nodule or lump that you may not really pick up on a CT MRI, if you apply tech to it and magnify it, it will support your early diagnosis. Therapeutics. Technology will help us monitor therapeutics perfectly. Personal health records. There are lots of wearables in the market. We can tap into that so that we are monitoring our patients remotely without encumbering them with huge machines and software. A lot of people use huge CPAP machines right now. I'm hoping those will get smaller and smaller as we go along. Maybe something that will just stick over your forehead. And then, of course, with bringing together disparate information, technology should be able to go to where the human eye and hand cannot see and mop up information about a patient and present it to us in an easy to read and consume template at the point of care to enhance decision making. So, healthcare is going to absorb more technology, use more technology all around.
Yeah, it's so true. Technology is already here. I mean, that there are so many different therapies and devices that are just coming up that are so interesting, right, for patient care. Um, Dr. E, it's been a pleasure talking to you today. Thank you so much for joining our podcast. We could be talking about your background for hours, and you have a lot of insight. So we'll probably bring you back in
I'll
to
be
cover
glad.
another. But thank you so
Absolutely.
much. Thank
Thank
you
you,
so much for
Margaret.
joining us today. It's been a pleasure.
It's been a pleasure sharing the stage with you. Thank you so much.
Thank you.
All right.
And thank you to our audience for watching today. If you would like to watch more of our podcast, please follow S2M Health on LinkedIn and YouTube. Thank you. Have a great day.
Have a good day, everyone.